And there we go. I will let you take it away.
Thanks, Jason. We really appreciate stewardship for inviting us out to talk about this. Yeah, it's unfortunate Amanda couldn't be here because she is like the champion and the magician that makes all this magic happen. But we will be providing her contact information throughout the presentation, as she will be your go-to person if you have further questions. I think Courtney and I are pretty laid back, so if you don't mind, Jason, I'll get you to monitor the chat just because I can't see the box, and please interrupt at any time if you have questions. We don't mind being interrupted. So my name is Jackie. My job with the SHA is a pharmacist at our infectious diseases clinic. I work particularly with people living with HIV, and I also sit as an advisory group member on the STEPS program. Pretty new to that, but have taken a lot of education through the STEPS program and have been involved with some of their initiatives. And I'll let Courtney introduce herself.
Yeah, so I'm Courtney Dalton. I'm a pharmacist as well with the SHA. I work in a part-time position as the Saskatchewan Provincial HIV Collaborative and STBBI program, which is essentially like a consult position between the SHA and the ministry doing education policy, that kind of stuff. And I also work at the University Hospital a little bit right now. And I was previously working with the Positive Living program, but hopefully the funding ran out for right now, but hopefully that'll be coming back soon. So I'm also a STEPS advisory group member, just like Jackie, and I've taken tons of education with them, and we were able to do a little bit of our own presentation, Jackie and I, just this spring, so that was great too.
Yeah, and Amanda, she's the program coordinator. Again, she is the headmaster of all of this. And so if you have any questions, we can connect you with her or reach out. None of us have any conflicts of interest to declare in regards to this presentation. So what we wanted to chat about today was a few quick things. One, we wanted to describe what the STBBI Treatment Education Program for Saskatchewan STEPS program was and what resources are available to people like you, healthcare providers. We wanted to talk about antiretroviral therapy and direct acting antiviral therapy, what that cost coverage looks like in Saskatchewan, and including like who can prescribe, and just clear up some misinformation that there is out there about that. And then Courtney's going to touch on what's on the horizon for HIV post-exposure prophylaxis in terms of a project that's been done and some medical education that may be coming. So a little bit of a mixed bag, and we hope you can take some learning points out of this, as well as learning what the STEPS program is and what it can do for you. So who is STEPS? Again, STBBI, Treatment Education Program for Saskatchewan. STEPS formed in 2022, just basically out of a necessity to provide education to healthcare providers on the growing epidemic of sexually transmitted and bloodborne infections that we have in this province. So STBBI, for those of you that aren't familiar, stands for sexually transmitted and bloodborne infections. Basically, viruses and bacteria and things that can be transmitted through sex or through blood-to-blood contact. That can be sometimes through needle pokes, injection, shared injection equipment. It can be, these viruses and stuff can be passed down from mother to baby, things like that. We, unfortunately, in Saskatchewan have had the highest annual rate of HIV and hepatitis C diagnoses for the last many, many years, I think at least 10. And we're one of the fastest growing rates of syphilis infections, which I'm sure many people in whatever healthcare capacity you're in right now are seeing or experiencing. And so this was designed to provide accessible, free, and locally based medical education to primary care providers or healthcare providers in general. There's an advisory board, and it's a very multidisciplinary group with expertise represented from infectious diseases physicians, family physicians, NPs, nurses, pharmacists, peer advisors. We have representation from the CME group, all people who have expertise and interest in the areas of STBBIs. So the goal of the program is basically to empower healthcare providers with the knowledge that they need and some confidence to help screen, diagnose, treat, and provide prevention for these infections in Saskatchewan. While a lot of the targets are family physicians and nurse practitioners who can do all of these steps, the education is open up to everybody. And you don't have to necessarily be a healthcare provider. You could be a peer or someone working with healthcare providers or people who may experience STBBIs. And just because you can't do all of these steps, maybe you can help with the screening piece or the prevention piece or the education piece. So the education is open to basically everybody. Another part of the education is to help address stigma and discrimination, and by promoting non-judgmental and trauma-informed care. And we also work to, I shouldn't say we, Amanda and the team really works to create a community of practice for STBBI treatment providers in Saskatchewan. So a large goal is to not only just like give you the education and say, here you go, run with it, but so that if you have a question or something comes up that you're not comfortable with or unfamiliar with, that you know you have peers, colleagues, infectious diseases doctors that you can turn to ask for advice and guidance. In terms of funding, it comes from the Ministry of Health in the form of an unrestricted educational grant, but the administration of it is through the University of Saskatchewan, and it's embedded into the College of Medicine under the Division of Continuing Medical Education. So very high quality education. I'll hand over to Courtney.
So we just wanted to kind of go over some of the different ways that STEPS does provide support for practitioners here in Saskatchewan. So one of the first ways is through actual virtual classroom live presentations. So those typically run through the fall and then also through the spring, usually anywhere between 3 and 4 different presentations. Some of them run during the evening, some of them during the day, and each year they're kind of variable depending on who they got lined up for that year. Also available, like each of those presentations is also recorded, and once you kind of get involved with STEPS, which all that information is on here, you can access all of those past recordings as well. Just for anybody who's interested in kind of getting caught up on what's been done through STEPS in the past. Amanda and STEPS also help coordinate different clinical preceptorship opportunities for anybody that's new to the world of STBBI. A lot of this is a bit more focused around probably HIV or Hep C treatment, because due to some of the designated prescriber lists, which Jackie will get into, but those are also kind of set up and coordinated through STEPS. STEPS through Amanda also helps, as mentioned, with that designated HIV and Hep C prescriber list, which Jackie will get a little bit more into, which is a bit more complicated than perhaps it needs to be, but it's nice to have somebody in the middle kind of sorting out and directing traffic. And she'll also, and through STEP, they also provide linkage to ID specialists and other experienced physicians for their mentorship and prescribing support, like ongoingly while you're providing care to people. So lots of different ways that they're involved in kind of supporting people that want to be involved in this area. Probably go on. So this is just an example of the virtual classroom and kind of one of our promotional materials. So this is the STBBI virtual classroom that ran this spring 2024. So there was a practical approaches to syphilis, HIV Prep 101, which I'll plug because that was Jackie and I that chatted about that. And then there was also a women-centered HIV care model. So those are all available to register in advance. And if you do register and you attend them, you can get actual accredited CME credits through there. And then, as mentioned, this is just an example of all of the different types of recordings that we do have available. And all registrants can have access to these recordings. You don't have to attend them live, and they would be also accredited for self-directed CMEs as well. So there's just a good example of all the different things and topics that we've kind of addressed over the last, I guess, since 2022, all of these would be up there. So a few women-centered HIV care, lots of different HIV treatment presentations that kind of go from the, just a broad view of what does HIV look like in Saskatchewan, and then over, kind of basic treatment, and then into more advanced, kind of looking at some more specific circumstances. So there's lots of good information there. Lots of different ones on syphilis as well, and then a few on gonorrhea and chlamydia, as well as preventing substance use infection. So I really encourage you all to get on there, see what's in there. If you haven't been there yet, there's lots of good information. I've seen, I think, every single one of these. So there's lots of good stuff.
There is a QR code on the screen. I'll leave it up for a few seconds if you want to scan it. It takes you directly to the website. It's also on the bottom there, steps-sask.ca. The password to the presentations are steps_sask. They really want everyone to have access to these, so I'll just leave that for a few seconds if people want to scan that. In terms of the CMEs, if you will get like a full CME accredited form if you attend live. Otherwise, if you're watching non-live, then you have to use the self-directed one depending on what your professional body requires. So I'll give that 5 more seconds. Okay, awesome. Any questions before we move on?
I'll just make another comment that you know, this is really geared to like providers in Saskatchewan, but we've actually had interest in the program kind of throughout nationally. I know like most recently Amanda had some people from Newfoundland reaching out being like, how do we get in with these? So it is getting some recognition kind of around Canada, but it's nice to have something that's locally provided with information about how to do it here in Saskatchewan. So
yeah, from providers that are experts in the area that you can reach out to afterwards. So the next section we wanted to talk about is a very sexy topic, drug coverage. And I'll try and make it as exciting as possible. But we wanted to highlight this because this is something Amanda, myself, probably Court actually get quite a bit of questions about, is who can prescribe these drugs for hepatitis C and HIV, and what does the coverage look like in Saskatchewan? So there's also been some updates as well. So we wanted to give just a little bit of a high level overview for those who may work with patients in this area, just to know what's going on. So what are you talking about? What are these abbreviations? I just want to make sure everyone's on the same page before I continue. ARVs are antiretrovirals, and they're a class of medication that are used to either treat HIV, and some common brand names of drugs that you may have heard of are Biktarvy, Dovato, Triumeq. Those are single tablets regimens that we use quite frequently in Saskatchewan. ARVs can also be used in different formulations to prevent HIV. And so we'll see drugs that someone can take after they've had an exposure to HIV, which is PEP, and they'll be on a course of medications for a period of time. Or there's certain antiretrovirals that can be administered prior to an exposure, PEP or PrEP, pre-exposure prophylaxis, to help prevent infection. So that's one class of drugs that I'm going to be talking about today. The other one is DAAs, or direct acting antivirals. These are drugs that are used to treat hepatitis C, and the most common ones we use in Saskatchewan are Mavorite and Epclusa. So those names may sound familiar to you. They're only used to treat hepatitis C. They're given for a shorter course of time instead of ongoing like HIV, and there is no prevention for hepatitis C in the form of pharmacotherapy. So just to make sure we're on the same page, that's what we're talking about today. And first, I'm going to talk about ARVs, or antiretrovirals. So in Saskatchewan, we're incredibly fortunate that in 2018, we established full antiretroviral therapy coverage for HIV. So what does that mean? That means these drugs are on the formulary, but they are a full benefit, meaning that there are no copays, there are no deductibles. If someone has an active Saskatchewan health card and goes to a pharmacy with a prescription for this, it will be free of charge, 100% coverage. Now, of course, there are a couple caveats to that. These drugs are what's called exceptional drug status, meaning someone needs to meet the criteria being that they have HIV, that there's not any resistance to these drugs that they're on, and that an ID specialist needs to be involved. So that's a little bit inconvenient. Anyone who's worked with the exceptional drug status program knows sometimes it's very smooth and other times it may not be. So to circumvent this delay of needing to apply for coverage, there's a list of prescribers that the drug plan has said, if the prescription is written by one of these people, we trust that they meet the exceptional drug status, it'll just go through automatic at the pharmacy, okay? This applies to all antiretroviral therapy, all of the medications that are available to treat HIV. And I just want to highlight, because this is another area of misunderstanding, is that once a prescription has been written, so say I have a patient and I start them on Biktarvy, for example, for treatment, say they go into hospital and now we're doing a med rec and they're being discharged, any prescriber can renew that prescription and it will be covered. It's just the initial one or any changes in therapy that need to go through the initial prescriber. So that's really important for continuity of care, to know that family docs, nurse practitioners, docs in Emerge or in a hospital setting can renew these drugs. For prevention, it's a little bit different. And this is very brand new. So we had some coverage for prevention in the past, but there are certain antiretroviral therapy drugs that we use. Tivicay and Truvada are the ones that I'm talking about. These are 100% covered by the Saskatchewan Drug Plan. So same as treatment, no copay, no deductible. They are free when a patient shows up, but they are full formulary status. This means there's no application for drug coverage. They don't have to meet certain criteria, and any prescriber can prescribe these drugs. This is new as of April of this year. So one thing that happened was our PEP, our post-exposure kits, have been updated. So they were changed to a newer regimen that people don't have to take as frequently. And the two drugs in these kits are a drug called Tivicay and a drug called Truvada. These drugs were then made full formulary status, and previously doctors needed to be on the designated prescriber list for coverage, but that's no longer the case anymore. So now any prescriber can prescribe, and the coverage at the pharmacy is 100%. This is really important in terms of access to these medications, because before, if someone went in, say, to their family physician or nurse practitioner or someone who felt comfortable to prescribe PEP, they would send a prescription, but then the pharmacy would be like, that actually costs $1,300. We need to apply for coverage. They need to get through to the drug plan, et cetera, et cetera. Now these prescriptions will just go through 100% without any paperwork or anything like that. So treatment, we have certain prescribers can prescribe and it goes through automatically. For prevention, anybody can prescribe and they're a full benefit. Just going to pause there for a moment because there's a lot of interesting lingo, but I don't see anything in the chat currently. Okay. So moving forward to Hep C treatment, or direct acting antivirals. This is another area that is brand new and why we wanted to talk about it. So previously, these drugs required a bunch of paperwork to be filled out, and there was still, once that paperwork was filled out, there may have been a copay, and we had to go through multiple programs to access full coverage for these medications. A course of treatment for hepatitis C is very expensive. It can be over $10,000. And so even a small copay of a small percentage, many patients could not afford. So as of May 1st, just a couple months ago, Hep C treatment in Saskatchewan is now also 100% covered by the Saskatchewan Provincial Drug Plan. You can think of it as exactly as treatment for HIV. So no payment for the patient, will go through automatically at the pharmacy if someone is on, the prescriber is on the designated prescriber list, and they do need to meet the exceptional drug status criteria, which is basically that they've had testing done in the last year that shows that they have hepatitis C and they're involved with a specialist, which could be a hepatologist, a gastroenterologist, or an ID specialist. So this has gone from lots of paperwork, very complicated process, to now being a much simpler, more streamlined process if somebody is on this designated prescribers list. So what is this? I just see there's a question there. I think I see it. So it said, is it a myth that Hep C treatment, only the first course is covered? And so, yes, that is a myth. We are able to re-treat people over and over again for hepatitis C. So coverage is still available. Court, there's no difference that you're aware of, but I've personally experienced that we've treated people multiple times.
Mm-hmm.
There's a yeah, that's, I think Sandra also said, can clients who are reinfected with hepatitis C get full coverage for medication multiple times? So yes, I believe is the answer.
Yes.
In there.
And we don't want the risk of reinfection to impact people deciding on who they should and shouldn't treat. So they can get repeat coverage. That's important. And it is still important to treat people even if they have ongoing risks. We want to provide education so they know what those ongoing risks are and potentially how they can mitigate it with harm reduction services. Getting their partners tested, sexual partners, for example, things like that, using things like condoms. And we want to continue to test people who are at risk for hepatitis C transmission. But yes, people can have multiple courses of Hep C treatment. So in terms of this designated prescribing list, like what is this? And it's a little bit of an enigma even to myself at times, but it's basically a list of prescribers that is maintained by the Sask Provincial Drug Plan. And the people on this list have expertise in treating HIV and hepatitis C. So there's two lists, one for HIV, one for hepatitis C. You can be on both of them, okay? ID docs are automatically, I would say automatically put on it, but I've had to help some of ours get on it. But they should be automatically put on it. And then other prescribers who have taken an interest in this area and done some extra training in HIV and Hep C management can have their names added to it. A couple of very intentional words on here is I use the word prescriber. This can refer to a physician, it can refer to a nurse practitioner, it can refer to a pharmacist like myself who practices in a collaborative environment and has a prescribing agreement. And there is no thou shalt do X, Y, and Z. There's not like you have to do this amount of courses or check this many boxes to get certified. This is not a certification process. The drug plan basically wants to know that you've done some education and you are connected to an ID specialist in case you have some questions. So with that being said, how does someone get on this list? And so if you're interested in this area, and we're always looking for more and more prescribers to allow for access because we need it. We need it in this province. You can complete some continuing education through the STEPS program, as we've talked about, and then someone needs to contact the Sask Provincial Drug Plan. And Amanda has been so huge in assisting prescribers with this process, so she'll help you contact them. For Hep C, you have to sign a document, so she'll help you with that document. She will make sure that you have like a mentor or somebody that you are connected with. For NPs, sometimes it's other NPs. Lots of times the drug plan want to know that there's an ID doc that you can go to, so she'll help you with that connection process as well. So just to summarize that, it's a list of people who've had an interest and done some extra training in this area. When they write prescriptions for these meds, they go through very quickly and automatically at the pharmacy. And if this is something that you're interested in, the STEPS program can help you achieve that. So I just also want to talk about NIHB or non-insured health benefits. This is federal coverage for people who have treaty status. What does this look like with them? Both HIV treatment, prevention, and Hep C treatment are 100% coverage through NIHB. Antiretroviral therapy for HIV goes through automatically, and any prescriber can prescribe it. So they're not checking to see if you've done extra training or anything like that. Hepatitis C medications require some paperwork, which is called prior approval. So you have to fill some stuff out, but any prescriber can prescribe these medications. So you take anything of that. This is my summary slide. You can take a photo of it if you want, or I don't know if Jason shares slides. These medications are 100% covered now, all of them, which is huge for us to say that, and we're one of the first provinces to do that. So that's a good feather in our hat, and it will be one piece of the puzzle for helping bring down our STBBI epidemic that we have. For prevention, these are open benefit. Anybody can prescribe for prevention. If we're talking about treatment, someone should be on the designated prescriber list. If you're renewing a prescription, you don't need to be, okay? NIHB, everything's an open benefit. There's some paperwork if you need to go do Hep C treatment, but any prescriber can prescribe. That's the drug coverage piece. And if you need help, Amanda, and I don't know why her email address is in the same green as everything else, but I'll add that in there in the chat. Okay, Courtney, is that?
Okay, so there has been a lot of work going on for me anyways, specifically in regard to PEP in Saskatchewan. So we just want to go over some of the changes and some of the things that are coming, just to give everyone a bit of an update, because I know it's been an area of interest and I think can be quite a clunky process as it stands now. So we just want to see what we can do to kind of improve that, improve access and improve prevention here in Saskatchewan. So you could go on there, Jackie. Okay, so the first thing that we're going to talk about is I was actually contacted by STEPS because as it stands right now for PEP in Saskatchewan, we have what are called PEP kits. And so PEP kits are basically 5 days of medication that are available in many different locations across Saskatchewan. I think we have like up to 80 essentially, mostly in emergency departments or other smaller health centers, depending on the location. And up until kind of April 1st of this year, Emerge physician could provide a PEP kit to a patient if they presented with some type of exposure that could result in potentially acquiring HIV. Up until that point, however, they had required that ID physicians actually be consulted within 5 days to either approve the continuation of the kit and approve the full 28 days of PEP or deny it. So this project came out of the fact that specifically in, I think in Saskatchewan overall, and definitely in Saskatoon, we were a little bit low on ID physicians, and they're very, very busy. So this is basically a project to see if we could implement some training for emerged physicians so that they could then be the ones to authorize the PEP kits and continue the prescription and just be like more confident and comfortable in that process. So with some of the changes that did occur in April 1st with the change in formulary status, and basically any provider can now provide. The PEP pilot project initially was to educate emerged physicians in Saskatoon, and then now it has actually expanded to probably more of a provincial education. So you could actually move on, Jackie, to the next slide. So here we are. So we had kind of launched this education that was kind of run through Dr. Kaya for, you could go back, sorry, Jackie.
Sorry, it had a mind of its own. I don't know what it was doing.
So the pilot project was initially for emerged physicians in Saskatchewan, but with these recent changes and the expansion to any provider being able to prescribe a full course of PEP, there's now kind of a greater need for that education and to provide that expertise to more and more physicians so that we have more and more people able to offer it. So now we are just in the process of developing an online module that'll be able to access at any point. That is self-directed, that'll be occurring through steps. So I think there's kind of plans for that to hopefully be launched in about fall of 2024. There's also going to be a retrospective chart review occurring to see if the PEP project that occurred over the last year with ER physicians actually resulted in any kind of changes in prescribing and different outcomes. So that's just something that they're still waiting on ethics approval for. And then also the same education planning group is looking at creating a provincial bloodborne and fluid exposure pre-printed order set that would be available to all emerged physicians throughout Saskatchewan. You could head on to the next one there. So I'm sure some of you probably have worked. So I know Regina and Saskatoon both had in their former health regions like a BBFE or a blood and bodily fluid exposure order set. So there's a couple that kind of out in existence right now. I don't think we've really figured out how many exactly exist, but we're kind of taking some of those that currently exist and hopefully creating, as said, a provincial one that we can get approved and be in use everywhere. So in that order set, it'll include assessment for the source person and the exposed person, the PEP treatment, what the follow-up should look like, the different HCV and HBV exposure management and follow-up, as well as applicable documentation. So this is actually a way bigger job than it sounds, because turns out everyone's process around Saskatchewan's a little bit different. So this is going to kind of coincide with hopefully some process revision as well, as like some documentation and other revision to basically streamline the PEP process provincially. Could head on to the next one. So coinciding with that, and I'm not sure if all of you are aware of this, but the Ministry of Health actually has guidelines for the management of exposures to blood and body fluids. So these are kind of like quite robust guidelines that have existed, oh goodness, I think from like 2010 and have had numerous updates over the years. So with some of the changes to PEP, as in the contents of the regimen, like the contents in the kit in terms of the regimen, as well as the changes to who is able to actually provide PEP and continuation prescriptions, there's been a number of updates to the guidelines. So there's a link on the bottom there. But if you just Google like Ministry of Health blood and body fluid management exposures, it'll all come up. They're a bit clunky as well. The sections that have been most updated right now are section 3, which describes the HIV PEP and who's able to prescribe it, as well as the antiretroviral. So I'm definitely thinking that with further, thanks Jackie, with further updates and kind of revisions to the processes, there'll be a lot of, these will kind of be revamped quite a bit, but they're in the process of it right now anyways. And then we've got one other thing. So one of my, there's a pharmacy resident in Saskatoon right now who over the last year has been doing essentially a PEP evaluation project of the current PEP processes in Saskatchewan. So we basically looked at like, okay, what is our current process in Saskatchewan? And then we've now surveyed nationally all of the other processes, which we're just waiting on collecting that data just to see how everybody else is kind of doing it. What are their restrictions? Where are they supplied? Just to kind of compare and contrast and see how our program relates to others, and maybe try to find some strengths, weaknesses to maybe hopefully work on making some improvements in terms of access. Another really, I'm excited to see some of the results for this is we're actually going to be looking at the number of PEP kits that have been provided in emergency departments. And then, so that's a 5-day supply on the medication. And then in terms of the regular process right now, people have to go and pick up the rest of their medications at a pharmacy if they are to continue that prescription. So we're actually going to be looking at those continuation prescription rates relative to the number of PEP kits actually provided. So that'll be a really interesting in terms of like how much is, access limited by, only getting 5-day supply or having to go to Emerge and then go to a pharmacy and all those different things. So hopefully the results of this will be able to, really drive home some of the issues we're having with access to PEP and hopefully kind of streamline some of the processes provincially.
Yeah, that's super interesting and will be great to see that data because I know just anecdotally, one of the barriers us at the ID clinic have is someone gets their PEP kit, they leave Emerge, but then there's not a reliable way to contact them. So they don't have a fixed address, they maybe don't have access to a phone. And so we have lots of people who, while it's great that they got immediate access to medications through the emergency department, but they don't have any follow-up. So they're receiving the 5 days versus the 28 days of treatment, which can be really problematic. And I know our ID clinic nursing staff does a great job of like doing their best to track people down and be detectives, but we just don't have the support in the community to do that and find these people. So some of these changes are really important to help keep that continuity and connection to care from the Emerge department back to the pharmacies.
Yeah, one of the big problems identified that hopefully we'll be able to come up with some solutions for is absolutely follow up and just being able to find the right people and know where they're supposed to go and just have an actual plan when they leave. So hopefully we'll be able to do something with that. Okay.
Yeah, so that's all we have. This is the QR code again for that STEPS web page. The website is also listed on this slide, and then that email steps@usask.ca you can use to reach Amanda, or I think Jason put her email address in the chat as well, so you can use either one of those. You can also reach out to Court or myself if you're interested in learning more about STEPS. Check out the education. There'll be a whole new program starting again in the fall, but all the other recordings are still up there. Or if you're like, hey, I want to dip my toes in this and I want to connect with a prescriber or do some mentorship or shadowing or learning, the STEPS program can help you do that. They really just want to take anyone who may have an interest in the area or seeing these patients in your practice, help them take better care of them. That's it. Do we have any questions at all?
Yeah, thank you both very much. I'm just going to stop recording and